Gvoke glucagon is a prescription medicine used to treat very low blood sugar in adults and children ages 2 years and above with diabetes. Please see important safety information at the end of this video and full prescribing information at www.gvokeglucagon.com.
My name's Katrina. I live in New Jersey with my husband and our 2 boys. My oldest is Wilson. He's 5, almost 6 years old, and he has diabetes. We had noticed him drinking water all the time, waking up in the middle of the night, dying of thirst, screaming for us to bring him water, which was super unusual. He would eat until his stomach was just sticking out, and he would be laying on the floor, sick to his stomach, and asking us for more food and saying, "I'm still hungry, can I eat something else?" And my in-laws were like, that's not normal. You should probably get that checked out. So then we went to the pediatrician, and that's how he wound up in the hospital with a diagnosis of diabetes. So the first time that Wilson had a severe hypoglycemic episode, it was March 2020. We came home at night, and right before bedtime, he wanted this little mini cupcake that we had for St. Patrick's Day, these little green cupcakes. So we gave him one, and we gave him insulin for it, and then he went to bed. So about probably 2 hours after he fell asleep, we were getting the notification that his blood sugar was dropping. So he'd gone in, given him his tried and true low treatment chocolate milk, and he drank it up, but it wasn't working. And about a half an hour after he had the chocolate milk, his blood sugar was still dropping, and he was screaming and kind of convulsing and flailing his arms and his legs on the bed. My husband's holding him down, trying to grab a finger to test his blood sugar, and he finally did get it, and his blood sugar was about 45 at the time. So I ran and got the old glucagon kit, and while he's flailing on the bed and my husband's trying to hold him down, and I'm trying to mix the glucagon, and finally got it together, and I injected it into him. And after that, my husband called 911, and the EMTs came. I think the most terrifying part was that he had these horrible hallucinations, and he still remembers it to this day, almost 2 years later. He remembers seeing the monsters, and we're not allowed to buy those little mini cupcakes anymore. In New Jersey, if you call 911 for hypoglycemia, they don't bring glucagon with them. EMTs are not allowed to administer it in New Jersey, and they really drove that home while we were in the hospital. If he had hypoglycemia, give glucagon, then call 911. After that, my father-in-law sent me an article about a pre-mixed, ready-to-use glucagon. So we asked the endocrinologist about it, and she was actually happy to give us a prescription for it, thankfully, because it was really terrifying in the moment to have to carefully get the needle into the vial and mix it all together, and we were very happy to get that prescription for Gvoke. So the second time Wilson had a severe low, it was later that year. We had been out at a birthday party all day outside in the heat. His blood sugar was okay, and then after he fell asleep, it started dropping again. This time it dropped a lot faster. He was still conscious, thankfully. He didn't have a seizure-like activity he did the first time, but he couldn't swallow. So I grabbed a juice box, picked him up out of bed. We're squirting juice into his mouth, and he's just crying, and there's just juice pouring all over him. My husband ran, got Gvoke, and we just opened the packet, took off the cap, stuck it in his thigh. That one, he doesn't remember, thankfully. Having a kid with type 1 diabetes, especially a little one, it's difficult. A lot of people have said to us, "I don't know how you do it, I could never do it." But you have to, it's life or death. So you have to get the insulin shots, you have to test the blood sugar, it's hard. It's nice to know that we have a lot of technology. We are living in an age where diabetics have access to so much great technology. He wears an insulin pump. Even knowing now, Gvoke is available, that we have that backup just in case we ever need it. It's wonderful. He just started kindergarten this year in September. So this is new territory for us, for sure. We met with the nurse and the school counselor and the principal, and basically we just told them what we were expecting of them, what they needed to do. He gets now a one-to-one aide all day long, just someone who sits with him personally. The school nurse keeps everything in her office. She's got juice and Gvoke and a glucometer and extra insulin and anything that we need. Some patients, they're the first one in the family to have diabetes. They don't know that there are other options out there, or, you know, some people don't have the internet, or they don't know that this is something that is available to them. Doctors need to know about this. Anyone who uses insulin, you have the possibility of getting a severe low. It's just, it comes with the territory. For me, it's a no-brainer. We have to have Gvoke with us at all times. It's, you know, it has been over a year since Wilson had his first low. I will never stop carrying it with us.
Indication: Gvoke glucagon is a prescription medicine used to treat very low blood sugar in adults and children ages 2 years and above with diabetes. Important safety information: do not use Gvoke if you have a tumor in the gland on top of your kidneys called a pheochromocytoma because of the risk of a substantial increase in blood pressure, have a tumor in your pancreas called an insulinoma because of the risk of low blood sugar, are allergic to glucagon or any inactive ingredient in Gvoke. Stop using Gvoke and seek immediate medical attention if you experience any symptoms of a serious allergic reaction, such as rash, difficulty breathing, or low blood pressure. Before using Gvoke, tell your doctor about all the medicines you take and your medical conditions, including if you have not had food or water for a long time, prolonged fasting or starvation, have low blood sugar that does not go away, chronic hypoglycemia, or have a history of a skin rash called necrolytic migratory erythema, commonly associated with glucagon-producing tumors. The most common side effects reported in adults are nausea, vomiting, swelling at the injection site, and headache. The most common side effects reported in children are nausea, low blood sugar, vomiting, headache, abdominal pain, high blood sugar, pain or redness at injection site, and hives. Inform caregivers on the instructions for use of Gvoke and symptoms of severe hypoglycemia, which include unconsciousness and seizures or convulsions. Store in original container until time of use and at room temperature between 68 degrees Fahrenheit to 77 degrees Fahrenheit, 20 degrees Celsius to 25 degrees Celsius. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please talk to your doctor and see full prescribing information and patient information guide for Gvoke at www.gvokeglucagon.com.